Hello everybody, I'm Dr. Vikram Mhasker, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. We're going to be talking about the 5 mistakes that delay fracture healing. So let's say you have a fracture. What should you avoid doing? Number 1, do not miss your follow-up appointments, right? So you've been diagnosed with a fracture, the doctor has given you certain instructions. Make sure you see him when he's asked you to see him. Why? Because what's in his mind, why is he treating your fracture in a particular way, whether with surgery or not surgery? He needs to see certain parameters in that fracture, assess you from time to time to be sure that the healing is happening right and no complications happen. So please see your doctor on time. Number 2, not bothering about the nutrition. Remember, you need a fuel to drive a car. For any process in your body, it requires adequate nutrition, adequate fuel for it to do its work. Every cell in its body requires food, and the food is with proper nutrition. So eating adequate amount of proteins, carbohydrates and fats, protein at least 1 gram per kg body weight, carbohydrates and fats are very important. Make sure you take adequate multivitamins if you're deficient. Calcium helps a lot, at least 6 months in a year for postmenopausal women or those who are calcium deficient or who have osteoporosis. Healthy diet, very important. Bad habits can spoil it for you. So if you smoke and you drink, smoking, what it does is it constricts the blood vessels or makes the blood vessels thin that supply the bone and helps it heal. It impedes healing. Alcohol can also get you nutritionally deficient and affect fracture healing. So these are a big no-no if you've had a fracture and you're hoping for it to heal properly. Resuming activity too soon. So your fracture healing is a natural process. It takes a period of time for the fracture to get strong enough, the healing to get strong enough for it to be able to do a particular activity. So please talk to your surgeon. He will tell you, depending on your fracture, what's the right time to go back to what activity. It starts with putting weight. Many times we do not let you put, most of the times we don't let you put weight on the affected part for at least 6 to 8 weeks because we know what's keeping it in place is either a plaster, etc., or if an operation is done, just the implant. Remember, these are not that strong to take all the body weight. The bones can move. So waiting till the surgeon feels normally takes at least 6 to 8 weeks for you to put some weight, 3 months for you to put full weight on a particular part. This could vary with the type of fracture that you have. Also, when the fractures happen, if you're not going to do the right physiotherapy. So most of the time when there's an operative fixation of a fracture, I let the patient move the part. So if you don't move it, you're going to get stiffness. If you're going to get stiffness, there's going to be a problem later on. So physiotherapy for movement when advised and for strengthening of the muscles should be done at the right time. If not done, it could complicate your fractures and you can end up with stiffness, etc. A bonus mistake is not sleeping properly. Your body needs rest for it to recover. And rest happens if you sleep well. So very important to have at least 6 hours of sleep if you're an adult and at least 8 to 9 hours of sleep if you are a child. So when should you worry? When there's persistent pain, even after 3 to 4 weeks of your fracture. If you look at it, there's a lot of swelling even now. If you look at it, the bone doesn't seem straight, it seems crooked to you. Then not to worry, but at least see your doctor to be sure everything is happening. If you're running a temperature, running fever after an operation, there is some discharge coming out of your wound, please see a doctor. It could also mean infection, and when treated in a timely fashion, there could be no complication at the end. So a snapshot of your recovery process. Fracture healing takes 4 phases. The first inflammatory phase or the hematoma phase, first 1 week or so where blood is there, a lot of cells are recruited for healing. Very dangerous phase because any movement can cause the fracture to move. Second is the soft callus phase, like cement. It becomes a little putty-like. The body has started depositing bone cells there. Bones are forming around it but not strong enough. This could take up to about 3 weeks or so. Then 3 to 6 weeks is the hard callus phase where this bone gets stronger and stronger and stronger. Then in the end, 6 to 12 months is the remodeling phase where the body decides I've thrown in too much bone, so let me now shape the bone back into normal, which is about 6 to 12 weeks. After 12 weeks, in most fractures, you can put full weight and walk. I hope you got quite a bit of information about fracture healing, what can you do to prevent any complications. I hope you like my video. If you do, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a silver button winning channel, which is in the bio. Please subscribe to it too. Thank you.